Share. Okay. First unit is overview of the cardiovascular system. So I'm going to run down what you need to know about the cardiovascular system and how it applies to the MBLEX. So basically, we want to go through the understanding of the system because you've already done a detailed studying of the system, but we're going to just go briefly through what it does, how it works, and how it's important with the body. So the cardiovascular system is our highway of transportation. It's vital to bring nutrients and waste out of the body. So just like the highway that we carry cargo on and we drive through, in order for us to be in good health, optimal health, the highways have to be clear so that we can transport in new minerals and nutrients to build new cells. We need to carry out debris from cells that are broken down, or viruses and so forth. So just understand this image in your head of it being our highway system. When disease occurs, our blood gets backed up, our highway gets a traffic jam pretty much, and then that's going to not allow our cells that are dying and trying to repair and regenerate get the nutrients it needs to rebuild. So those cells, as you know, might be bone cells, skin cells, neurons, any cell in the body. It needs to be transported from a different portion of the body, or the nutrients and building blocks have to be transported so that those cells can rebuild, repair, and replicate. Our blood is made up of plasma, white blood cells, platelets, and red blood cells. So if we take a sample of blood, put it through the centrifuge and spin it, it's going to separate this plasma, which is that yellowish fluid that has our nutrients, proteins, hormones, and waste products. Of course, we have our white blood cells, which are working to be our Luke Skywalkers, the leukocytes that are going to fight the bad guys, platelets that are going to patch up any wounds, and the red blood cells that are going to transport oxygen to our cells. So red blood cells, erythrocytes, these are our lifesavers, and they have hemoglobin, which I think of the Green Goblin flying on a saucer, holding and carrying oxygen, traveling down through the system and delivering oxygen from the lungs to the rest of the body. Each blood cell lives for about 4 months. So it takes new blood cells to repair, to grow, and to replace those ones that are dying. And these red blood cells are in bone marrow that come out. So if this highway is not clear, then there's going to be disease and dysfunction. White blood cells, leukocytes, I call them Luke Skywalkers, because it helps me remember that these are going out and they're seeking to destroy bacteria, viruses, germs. They are our defense system to help our planet stay alive. Okay? Here's a list of the white blood cell types. Neutrophils, Luke Skywalker flies in his X-Wing and neutralizes the enemy. Then you got eosinophils, basophils playing the bass, promoting flow in the body. And then you got your granulocytes, you got your angry Mr. T there. T cells destroying cancer and viruses, infected cells. Lymphocytes in the lymph system, monocytes. You got the Pac-Man that is eating other pathogens. So phagocytosis, phago meaning eating. Then we got platelets, which under a microscope, they actually look like a small disc and a small plate. They are unactivated and they're floating around in this way. But then once we have some sort of cut or leak in the vascular system, then this transforms like a transformer and creates this like long kind of goop. And then it goes and it patches up the whole to prevent any sort of hemorrhage and leaking. So this is very, very much needed for our body to not bleed out. So like I was saying earlier, the red blood cells or the hemoglobin or green goblin is flying on these discs, and then this blood cell is going to the lungs and it's picking up oxygen and then going out to the rest of the system, delivering oxygen, and then coming back through the veins to come to the lungs again to pick up more oxygen, and that cycle continues. So like I said, coming from the heart, going to the arteries, going to the veins, capillaries, then this venous portal is dropping off the oxygen and then carrying these red blood cells back up to the heart where they're going to get more oxygen. Our blood and our stomach contents have to have a proper pH balance. So this is an acid-base balance. The healthy ranges need to be in this healthy range. You see here, 7.35 to 7.45. If it's too acidic, then it's going to cause acidosis and cause death, too much acid. Or if it's too alkaline, it's going to cause death. To maintain that homeostasis, we need to maintain a balanced pH in the body. So this pH just means potential of hydrogen. So hydrogen needs to be balanced in the body. Because of our diet, we can tend to be too acidic by eating a lot of acidic foods, fried foods, oily foods, and we want to eat more vegetables to bring our body to an alkaline state. Like I said, fruits and vegetables, soybeans, tofu, nuts, seeds, legumes are alkaline promoting foods. Dairy, eggs, meat, most grains, and processed foods are going to be on the acidic side. Talking about blood type, everybody's blood has descriptors. Okay, so these proteins are descriptors, and depending on how many of these you have in your blood, it's going to determine what blood type you are. It just means, do you have more of this Rh protein or do you have less of this Rh protein? And you see how if you had like a puzzle piece, a puzzle game, in order to match one blood type with another blood type, it has to have the same lit up protein to actually match that protein. Otherwise, the body will reject this blood and it won't work properly. So each blood type has to match. O negative has all of these Rh proteins, so this can actually be a universal donor to giving to the other blood types. So Rh protein just means rhesus factor. It's just a inherited protein found on the surface of red blood cells. If your blood has the protein, you're Rh positive. If your blood lacks the protein, you're Rh negative. Simple as that. Okay, so like I said earlier, blood clotting, your platelets come into effect when you have an injury or damage. The vessel contracts to try and slow down the perfusing of blood, and then your platelets come in and they actually plug the area, and then they create that fibrin and create that kind of scarring mesh to help heal that area so your body can repair. All right, going to the heart, main mamma jamma of our system. We have the three layers. We have the epicardium above, epi meaning above the heart, myocardium in the middle of the heart, the meat of the hamburger. So myo, meat, cardium of the heart. And then we have the endocardium in the dough, so inside of the heart. So the epicardium is going to be the blood supply of the heart. The heart needs to pump blood out to the body, but also needs blood itself to maintain health. So it's going to have these arterial branches that are going to supply the heart muscle itself. All right, then we get the myocardium. This is the meat of the heart that actually creates the thump. This is going to make the majority of the thickness of the mass of the heart wall. The endocardium is going to be simple squamous endothelium, so it's like a very, very thin layer, and it's really there kind of like the lining of cans to help your beans not be absorbed into the aluminum, or it leaching off as much. So this is just keeping the blood from sticking to the inside of the heart, so it can actually pump out into the rest of the body. All right, so you pump blood, so the right side of the body receives the oxygen poor blood, which is in blue here. Then it's going to go to the lungs, pick up oxygen, get rid of carbon dioxide. Then it's going to go back into the heart chambers, and it's going to pump to the left side of the heart, full of the oxygen-rich hemoglobin carrying oxygen. And that's going to pump through the arteries to the rest of your body, and the cycle continues. So we have different sections of the heart. We have the right atrium, which is just like going into a hotel. You have the atrium. You have those first set of doors. You come in, there might be a large chandelier. There might be some tables with flowers. And it's kind of like a little waiting area before you go into the second set of doors, going into the front desk or lobby. So everybody comes into this right chamber. The doors close. The pressure builds up. Once everybody's in this chamber, then the other doors to the right ventricle are going to open up. Then you're going to go into the main hotel. Then you're going to go down the hallway, go into your room. So this is the analogy I like to use to understand the difference between these chambers. The blood has to fill up in the right atrium before it can actually open the doors into the right ventricle. And then it's going to fill up there and put pressure and go into the lungs, and then go back into the left atrium and to the left ventricle, and then out to the body. You also have septums, which is just a dividing wall to help keep each section of the room together. So it's just like the walls in between the hotel rooms, keeping every section separate and keeping the pressure of the blood in each area of the heart. So these valves are one-way valves. The pressure builds up, they open, then they close. So blood cannot go backwards. So this is important to have proper blood flow going through in one direction. If it goes backwards in a different direction, it's going to cause issues, and it's not good. All right, we have the valves. We have the tricuspid valve. So tri meaning 3, and the bicuspid valve meaning 2. So 3, obviously you need more doors to open up because you want more blood to flow into the heart to bring to the lungs. And then you have bicuspid because you want it to come in slower, because the lungs have to do their job to give oxygen to the blood. So you want more time for that to actually bring in oxygen-rich blood into the heart. So the bicuspid valve is mimicked after a mitre hat or a bishop's hat, because it has, as you can see on top, it has those two flaps. And again, with the heart, the one-way valve going through, closing down, blocking off, so blood does not back up into the heart. You want the right amount of pressure to have the heart squeeze and pump the blood out into the body. If the pressure is too low, then it's not going to get the blood all the way down to your extremities. And if the pressure is too high, then it's going to cause high blood pressure and cause pretty much like hooking up your garden hose to a fire hydrant. It's not good for your blood vessel. All right, a cardiac cycle, we have the actual thump. So we have the systole, contraction phase, where it squeezes the blood into the system. Then we have diastole, which it dilates, just like your pupils dilate and opens up and the muscles relax to bring in more blood. So thump, 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 thump. And there's ways for you to take your pulse to actually understand and feel that thump thump. But just know, systole, it goes into the system. Diastole, it dilates and opens up and relaxes. Okay, tachycardia. So this is referring to the EKG where it's reading the thump thump on the screen. So it's showing a normal EKG, you have this diastole, and then you have the pressure in it. Thump, pressure, diastole, thump, pump. So we want this to be a normal, nice space. If it goes it's too fast, it's pumping too quickly, and that's not good. That's not good for the heart. Your body is not pumping efficiently what it needs to be. So it's tachycardia. So tachy meaning fast heart. So if somebody has heart-related conditions, high blood pressure, also known as hypertension, they're not getting enough blood supply to the heart because they have like some sort of plaque buildup and things in the blood vessels. So like sclerosis means hardening. So like hardening of the blood vessels and valves can actually cause the blood not to flow properly into the heart. So different reasons why somebody would have tachycardia, but again, this is not a good condition. Then we have bradycardia. So brady means slowing it down. So average beat per minute is 60 to 100 times a minute. So if you have bradycardia, it means it's below 60 beats per minute. And if the blood is low, it's not getting enough oxygen to the cells. So that's going to be an issue because our cells need to breathe just like we need to breathe. And there's actually kind of different training zones where if you've ever looked on a treadmill, you are going to run, put in your height, weight, and all that, and then it's going to, you're going to jog and run, and you want to stay within this actual kind of moderate rate so that you don't overpressure your heart, and that your heart can actually pump enough blood to your lungs to get oxygen as you're breathing heavy to then bring that oxygen to your brain, to your body, to your muscles. So we need to stay at a more kind of even pace, and then we can train ourselves to have a more efficient cardiovascular system to pump more oxygen to the muscles and to the brain as we breathe heavier, breathe in more oxygen, breathe out more carbon dioxide. So the more we train, the more we walk and run and jog. That's why it makes it easier for us to breathe heavy and to go a longer distance with our heart pumping faster. Our heart needs a wiring system. So this wiring system is actually coming from the brain, pump at different times. The heart needs to be told what to do. So we have these nodes. If you've ever seen the traction, and it's going to actually squeeze. Once the signal comes down to the Purkinje fibers, this is where that wiring goes to actually help the muscle. All right, so arteries, carry blood that's oxygen rich. This is our main pipeline to the rest of the body. I'm going through the arteries to arterioles, capillaries. I'm going larger to smaller, and then being absorbed back into the venous system. Right. And as you can see, arteries are much thicker. They can actually contract and expand more. So if you have higher and lower blood pressure, they can move accordingly and not burst and not have damage. Veins, on the other hand, are much thinner. So some people can have varicose veins, have enlarged veins, and they can actually burst or become damaged if we actually hit our arm or have an abrasion or something. And then of course capillaries are like the smallest ones that are very fragile. You might notice if somebody has like a red eye, kind of like a veiny kind of pink eye, those capillaries can actually swell and sometimes break, and then it kind of spreads into the eye. So those are the smallest kind of little bitty strings, if you will. Again, systolic blood pressure when the heart beats, the squeezing into the system. Diastolic blood pressure, it's going to relax. Okay, so this is important. So venous return, our body is, of course, in gravity. So as we're in gravity, blood flows down. But we need to actually pump it back up. So we need to squeeze those skeletal muscles in the lower leg and thigh and foot to squeeze the blood back up. And as it goes back up, it gets closed in the valve so it doesn't go back down. And then we squeeze again, it goes back up and it gets closed in the valve. Same thing. Then we go all the way up to the heart. People who have edema, who have buildup in the ankle, fluid buildup, have a hard time. Either these valves are broken, or they're malfunctioning, or the person is just too sedentary and not moving enough, not getting up and moving the muscles to actually squeeze the fluid up. So that's why massage therapy is really good to help bring that flow back from the extremity back into the heart, and helping that circulation go to heal the body, to bring out waste, to bring in nutrients, bring in oxygen. Especially if there's like fluid buildup, to help bring that fluid back through the lymphatic system, back to the heart to be flushed again. So we want to keep the cycle going. Okay. So creating that pumping action manually, if somebody can't do it on their own, or if they're in a wheelchair, or for different reasons also to help accelerate healing. If somebody had like a sprained ankle or something, to help accelerate healing so they can get back to life quicker. So what we're doing is we're removing waste products. So as our body transports those nutrients and minerals to the cells, those cells rebuild, but then they have to breathe. They have, just like going to a site, like a building site, you're going to have broken pieces of wire and concrete and all of this. All this has to go somewhere. So then our body, our blood system has to bring it back into our kidneys and our liver, and get everything filtered out. So in order to do that properly, we need to be using this venous system and this contractory system to squeeze the muscles and squeeze the blood out and squeeze all that waste out. And then allowing more oxygen and more nutrients to come into the tissue. So we're just kind of the helpers to accelerate and kind of clean up everything and get things flowing again. So as you can see here, an example of venomotor tone, the muscles in the calves contract, squeezing the blood up, and the valves close off, helping the blood go back to the heart. So here's an example of those capillaries, hyperemia, just meaning increased blood into those vessels. So those little capillaries are going to be larger than normal, but they're normally very small, kind of under the white of the eye, and you can't see it as prominent. All right. So we have different types of hyperemia. So first is active hyperemia, where there's an increased blood supply to an organ. And like if you're exercising, your blood flow is going to be just like swollen. Like if you're in the gym and you're really getting swole, all that blood is just really pumping to your organs and pumping to your skin and your muscles, causing a increase of blood flow. You're like super hot because you've been like running a marathon or something. So it's going to do that. Then we have passive hyperemia, where blood can't exit properly, so blood gets kind of trapped and stuck, and then it gets stuck in one area, and there's this kind of like this swelling and redness area, where you get this congestion. So in Chinese medicine, they believe that when you do cupping, and you see those purple or red marks, the darker it is, the more of this congestion of this blood flow is, and it's not flowing properly. So that's going to help the restriction of that blood flow and really get circulation going, so your body can replenish that tissue and heal that tissue. Okay. So, causes of hyperemia: exercise, too much heat, digestion. You got the itis. You eat a big turkey dinner, and your gut's full, and you got inflammation during infection, menopause, hot flashes. You know, getting really flushed, just like a lot of blood flow at one time, heating the body up. All right. So causes of passive hyperemia, heart failure. Your heart is not pumping properly. Things, not pumping properly. Um, Blood can get backed up. That hose is not turned on all the way. It's kind of just dripping out. So that's a problem. Deep vein thrombosis, DVT. So, like I said, when those veins are very thin and smaller, they can actually swell and then come to the surface, and then they're going to have these deep veins are coming to the surface, and then you can see them on the leg. And that's why for us therapists, working deep tissue on deep vein thrombosis is contraindicated, because we can actually cause more damage to those vessels because of how thin they are and how close they are to the surface. Also, they can have blood clots, like actual thrombus there, like a blood clot. And if we hard, we can actually push that into the heart. And that is a problem, because you can have a embolism, and it can block up the lungs and block up the brain. It's not good. And then hepatic vein thrombosis, which is less common. This is a blockage in the veins of the liver, causing a blood clot. So this is something that you don't really see a lot. But deep vein thrombosis is one key thing that will get tested on, and that is going to be common in your practice. Okay. Now to the MBLEDS question review.
It was doubled up. Okay. But did you kind of hear what I was saying? That's so weird. This I see my internet's being funky as well. So we're transporting nutrients, transporting oxygen. The venous system, the blue, is going to bring the waste and the red blood cells that have already dropped off the oxygen back to the heart, and it's going to pick up more oxygen. So if somebody has, let's say, sciatic pain and their hip is so locked down on one side, then it's going to be very difficult for that blood flow to get down to the toes and drop off the oxygen and nutrients, and then the venous system to pump the blood back up through the hip into the heart. So the more we can increase range of motion in the joints, especially where at the shoulder and the hip where the extremities connect to the torso, then it's going to allow better blood flow and better nerve circulation to communicate to every cell of that arm and limb, right? If somebody has deep vein thrombosis, the more that the system is backed up, it's going to cause more swelling in the area where the actual valves are busted, right? So it's like those valves, those one-way doors that push the blood back to the heart, those get busted, and or they break down and not function properly, and the blood fills up, and then it pushes to the surface of the skin, causing the little snake-like veins, right? So it's not just about effleurage and pushing circulation to the heart. it's also about making sure that there's no impingements where the limbs connect to the body, right? That's super important. So if we have really a stiff neck and this like forward head carriage, it's going to put pressure on the neck and kink the hose of the blood flow going to the brain, and that person's going to be more lightheaded, going to have brain fog because they're not getting enough oxygen to the brain, right? Or having numbness and tingling and kind of skin issues in the hands or arm. They're not getting, the nervous system is not properly communicating down to the fingers. And also, if there's like skin issues and like arthritis in the joints, then that blood flow is not getting in there to repair and nourish the bones and the tissues and the cells, and then the waste is not getting out to being flushed back through the system to kind of clean that sewage out. So this is super important to really understand that we have to work with mobility as well as just circulating blood flow, because we can do effleurage all day long towards the heart, but if there's a kink in the hose, then that blood is not going very far. All right. Any questions of how this is affected in massage therapy? No questions? Cardiovascular contraindications, yes. So one of them I describe is the deep vein thrombosis. So if somebody has visible looking veins in their lower extremities where they usually are, then we need to just modify our pressure, like not having deep pressure over those areas. Sometimes people come in, they're like, I want deep tissue. But you're like, I'm noticing that you have deep vein thrombosis. Maybe they put it on their medical chart or they didn't, but you can see that they have varicose veins, right? Like those snake-like veins. And you're like, well, those veins are coming to the surface of the skin. If I do deep tissue on those areas, the likelihood of me breaking those capillaries and causing damage to you is higher. So I'm going to avoid those areas, of using deeper pressure. So using moderate to light pressure on those areas, and any other areas that have, usually hips and up, I would do heavier pressure. Also, what's my energy doing this? Okay, and it's being funky. Also, if somebody is on, let's say, blood thinners, like they have high blood pressure, so the heart is pumping at a rate where it's trying to get the blood to the fingers and toes, right, into the organs, but it's having a hard time. So then the blood pumps harder, or the heart pumps harder, and the blood pressure on the walls of the vascular system, so the walls of the tubes, are increased. So if somebody is then going to go to the doctor says, hey, you have high blood pressure, and ideally you want to do more holistic interventions of having them change their lifestyle. But if somebody doesn't want to change their lifestyle, then they're put on blood pressure medications, right? So these medications are going to reduce the blood pressure, but they're going to kind of artificially make the walls more kind of elastic, right? So kind of taking out some of the strain of the walls, but the walls get thinner, and then the person is at a higher risk of bruising because the medication is changing the way the body works, right? So if somebody is on a statin or a different kind of blood pressure, blood regulator, then their likelihood of getting bruised is higher. So again, doing deep tissue on these people is not recommended. A lot of times people will come in, not a lot of times, but sometimes people will come in and they'll try and tell you what they want. I want deep tissue. I want you to steamroll me, blah, 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 blah. And you have to say, okay, I understand what you want, but I'm the practitioner. I'm looking at your medical charts. I'm seeing that you have a past history of blood clots. So it is contraindicated to do deep pressure if you've had blood clots. So we're going to avoid, doing this deep pressure, and then ask them, where did you have these blood clots? Where were they found by your physician? And then kind of like not really avoid that area, but just do like a light pressure on that area. Anything deep might dislodge the blood clot, or if they have one or not, like you don't know if they have one. So you don't want to just kind of go in blindly and press on them. But yeah, so the chances of somebody coming in with DVT are lower, but a lot of people are on blood pressure medication. So it's just being mindful of the amount of pressure that you put on them if they are on these medications. Let's see, what else? Oh, if somebody has like low blood pressure, I tell everybody to do this. I will lower the hydraulic table down like very low, and I'll say, get up slowly, put your feet down on the floor and kind of sit for a second and then stand up. Some people that have a tendency to have low blood pressure, typically older people, like more geriatric people, they're less active and their heart doesn't really have a high heart rate variability, meaning it can't really go from a slow pump to a fast pump too quickly. So if somebody is laying down flat and then they stand up too quickly, the blood has a hard time going to the brain, and then the person gets dizzy and they might pass out and kind of fall over, right? So we don't want anybody falling and hurting themselves. So just making sure that you tell them, hey, take your time, please sit up, put your feet on the floor, get up slowly. Even somebody that's younger, if we're doing a vigorous massage, pushing the blood flow and increasing the circulation, them just going from that supine position to standing up, they can get dizzy, right? So it's just kind of just warning them. But if somebody is older and they have a medical condition where they have a low blood pressure, then yes, that could happen as well. What else? I think those are the most common things that you'll see. Yeah. I think that's it. Anything else? All right. Well, if you guys have any questions, We're now in study mode. There's like, 2 assignments you guys have if you're caught up. I don't know where you guys are at, but yeah, again, I'm here for any questions of any other assignments that you're going through, that you're working on. So I will be around.